Let's Talk Merrimack. I'm your host for today, Jen McInnes. When I'm not teaching or in parent mode, some of my favorite things involve gardening or crochet and video gaming. Right now, Stardew Valley is kind of the current fave. The goal of this show is to talk about things that concern Merrimack residents and encourage you to get involved in the town. Today's topic is focused on the American Cancer Society Cancer Action Network. And today I'm joined by Maria Louisa Gay, the ACS-CAN ACT lead for the CD1 Congressional District. Welcome.
Hi, thanks, Jen.
Could you introduce yourself? Tell us a little bit about you.
Sure. So I've been a resident of Merrimack for 3 years now, and I absolutely love the town. I'm originally from Phoenix, Arizona, and so it's a huge change, but I love it.
Yep.
And I really love getting outdoors. I love cooking. I love gardening, so it's just really a great place to be. And I'm really passionate about the volunteer work I do with ACS-CAN, and I've been a volunteer with the American Cancer Society for about 8 years now.
Fantastic. So ACS-CAN, that's the acronym for the American Cancer Society Cancer Action Network. Can you tell us a little bit about ACS-CAN?
Sure. So the vision statement for both is to end cancer as we know it for everyone. What's specific about the Cancer Action Network is that it's focused on evidence-based policies and how we can make those work for everyone. So we really focus our efforts on policies, on amplifying the voices and getting platform for people who are suffering from cancer and want to be heard, or how we can bring their stories forward to policymakers. Also working with candidates and understanding where candidates stand and making sure that we know where they are as they're going to be elected. So we really just focus on candidates, on policies, on making sure people's stories are heard so that we can bring better policy forward to help people who are suffering from cancer.
That's fantastic. What inspired you to start volunteering?
Yeah, so cancer runs deep in my family. So my grandmother and my aunt both died before they were 70 from cancer. My maternal grandmother first got cancer when she was about 36. She had uterine cancer. And then my mother, my father, and my father-in-law were all diagnosed with cancer within a 1-year period. So 3 out of 4 of my kids' grandparents. And all at different stages, all with varying outcomes. My mother had been a smoker since she was about my daughter's age, about 14. And she had bladder cancer, and as a woman and as a non-native English speaker, I think she had a really hard time being heard. It took about a year to catch her cancer. She has an ostomy bag now, and it was really a big change in her life. And so that inspired me to start volunteering. It also just made me realize that people really need to be heard. They need to understand. So it kind of got me more involved on the education side. And then that just kind of slowly drifted into the policy side. When I moved to New Hampshire and I was looking for volunteer opportunities to continue with the American Cancer Society, I was contacted by CAN to be a part. And then I attended my first Cancer Action Day at the Capitol. And we have that coming up this Thursday, and that's when all of us volunteers with the American Cancer Society Cancer Action Network go and speak to our legislators in Concord about what's important here locally.
That's fantastic. We have a lot of legislators in Concord.
We do. So, a lot of sandwiches we get ordered to talk to them at lunch.
I imagine, yeah. So what impact has the work of ACS-CAN had, of those volunteers had in the community?
Yeah, so I would say, specifically since I've been involved, one of the ones that was memorable for me was here in New Hampshire talking about the kind of the secondary screenings for breast cancer. So through the ACA, your mammogram was always covered as a screening exam, but sometimes people get called back if they have dense breast tissue or they need a second level screening like an ultrasound or an MRI, and then that would be considered diagnostic and you'd have to pay your co-insurance. So ACS brought forward or recommended legislation to have that covered also as a screening exam. And so on one of our Cancer Action Days, we went and spoke to our legislators in Concord about that, and got really great support, actually. I want to say it either passed unanimously or -2 legislators.
Wow.
Yeah, and so sometimes those types of bills can go through almost as a rubber stamp, I've heard, but actually it was really important at the State House for it to go to the floor and a vote, because people felt so passionately about it. And I think anytime something like that can get such broad bipartisan support, it really feels like a huge win. And I think it's a huge win for people who find these kinds of screenings and the cost of them prohibitive, and can get sicker because they don't get them.
Yeah, absolutely. That's a fantastic win. Wow. So are there other big wins you can think of, or is that kind of the one that comes to mind?
Yeah, so there's another one, and we should look out for this one because it's coming. This one's more on the federal level.
Okay.
So it had been about, I want to say, a couple years in the making, and it's called MCED, or the Multi-Cancer Early Detection Act. It was just signed into law this past February, so 2 months ago, about almost 2 months to the day. And what it is it's ensuring that Medicare already has in place to cover screenings for an innovative new test, which is a blood sample that'll screen you for up to 50 cancers. So with just a single blood test, and it's not really going to replace mammograms and prostate exams and colon cancer exams, but it will test for those and more.
Wow.
So it's set to go into effect. It's kind of on the back of that clause in the ACA that, you know, screening exams are covered. But again, also like broad bipartisan support, people kind of, you know, almost being in line to co-sponsor it. And you know, like anything else, I think there was a lot of negotiation, like, oh, we can't like immediately cover it for everybody, so it's getting phased in by ages. But I think starting in 2028, so if you're 65, then it'll like phase in each year for each one. So
Okay.
it's kind of something, and I think I saw it on television being announced, like so it's the same maker as Cologuard and all that, but
Okay.
it's kind of cool because it'll even be able to test for pancreatic cancer.
And that is, I've heard it called a silent killer. That's really a hard one to detect, I think.
Yeah.
That's fantastic. And you don't hear much about bipartisan wins, so knowing that the ACS is having success there is really great. How can ACS-CAN help Merrimack residents?
Yeah, so sometimes I'm always like really surprised at things, you know, when I get to go to Washington and meet with our legislators from New Hampshire once a year at what they do know. So I know that in Merrimack there's a much higher incidence of kidney cancer than there is in the rest of the state. And that also goes for areas like Portsmouth with other types of cancer because of like the shipbuilding industry and whatnot. And I think it was in September when I went for our annual leadership summit and lobby day. It was the healthcare aide in Senator Hassan's office, and she was aware of that. And so I think it's important that in Merrimack, you know, when we are experiencing issues or when any constituent is facing something that that needs to be known, just either being involved with the organization or connecting with one of us who's an ACT lead or a state lead ambassador so that we can amplify that story, because people really, really are listening and the constituent voices are important. So I think that, you know, we want to know what's going on. And it was, I'm not pitching or anything, but it was also Senator Hassan's office that we were visiting with, where the healthcare aide here locally in Manchester invited us and said, hey, if you have any Medicare stories, like people who, you know, are relying on Medicare, be it temporarily or permanently for this reason, and it's part of we keep a Medicare book, you know, please let us know, because we want to make sure we have those stories as well when we're on the Senate floor fighting for Medicare. We want to have those stories.
Yeah.
So that's how we can help Medicare people in Merrimack. Is we want to make sure when there is a need related to cancer, related to healthcare, we have, you know, your voice and we have your back.
That's fantastic. And yeah, so to explain, it hasn't been you personally working with Senator Hassan, I don't think, right? Because there's these ACT leads. And so you work with the CD1, you're the ACT lead for the CD1 Congressional District. Could you talk a little bit about how that works? How you work with representatives and senators and such?
Yeah, exactly. So the way the works is, so you have American Cancer Society Cancer Action Network volunteers. So you volunteer in the organization, and then each state has a delegation, and that delegation maps to the size of your delegation in Congress. So usually the state lead ambassador will map to the longest tenured senator, and the vice SLA to the second to the other senator. And then one ACT lead per representative.
Okay.
So I'm mapped to CD1, I'm in CD1. But oftentimes we'll go as, since there's just 4 of us, we'll go, whoever can go, we'll go all together. So
Okay.
there's been times when just all 4 of us go, because there's only 4 of us. If it were Texas, that would be kind of hard in some of those little offices.
Yes.
But we sometimes manage to make it work, but sometimes it's just one of us.
Okay.
But it's kind of cool because we're all sort of, assigned to someone, and we get to build up those relationships. So I know in Senator Pappas's office, the healthcare aide in DC was just amazing, wonderful. I remember one year, we show up in September with our packet of information, and it's here's the stats for cancer research funding and how much money it brings into New Hampshire and all the, jobs. And she said, I know you guys have to bring this because you're going to all the offices, but I just really wish people just cared about better outcomes in people's lives. And I was like, oh,
Yeah.
that's so great that you would say that. So
That is great.
Yeah.
And staff is so important. I'm glad to hear that you found receptive staff in these offices.
Yeah, receptive staff and people who get, are responsive.
Yeah, that's fantastic. So could you talk a little bit about how ACS-CAN has helped you develop skills in your time with them?
Yeah, so I think that, it makes it sound like, all the staff and everyone's so responsive and everything. And I think a lot of it is the training that they give us as volunteers on how to communicate, how to make asks, how to, they call it hook, line, and sinker. So tell your story, clearly state your ask. And so you get trainings on how to be really effective in your communication, how to make sure that you do get those responses. And then in election years like this year, we also have a program called Cancer Votes, where you get training on how to show up at town halls and different election events and ask candidates questions very directly about, do you support maximum levels of research funding? Where do you stand on expanded coverage for Medicaid? And make sure that, they're very clear. Where do you stand? How would you vote? So that, when we go back in the fall, we say, can we count on your support, just like you had stated in the past? And I guess that's a tactic called bird dogging, and I had never heard of that before, but it's something that I, learned. So I think that it's really great in teaching you, how to just ask for things very clearly, and it, it makes you feel like you're kind of getting somewhere.
Yeah, and that sounds really helpful for all of us. Especially, we have the CD1 election with 7 candidates in the Democratic primary and several in the Republican primary. So having someone at those election events to ask those questions is helpful for all of us.
Right, yeah.
What keeps you motivated as you keep volunteering?
Yeah, as I keep volunteering, whenever anybody shares their cancer story with me, it never, it doesn't really bring me down, it brings me up. So I was talking to somebody once at I think it was a craft fair, and his mother had died of lung cancer. And at the same time, we were learning about biomarker testing, which is when they can take a sample of somebody's tumor tissue or some kind of genetic material so that they can deliver more precision medicine. And so he didn't understand how his mother could have progressed so quickly through lung cancer, how, she was seemingly healthy and then, was sick, died very quickly. And it had just happened maybe that like a week before or 2 weeks before I'd been through ACS-CAN with Dartmouth Hitchcock Cancer Center, learning about how they can take this biomarker testing, and if you have 20 people with lung cancer, 10 people will respond to the first line of defense treatment. The other 10, won't, and then maybe 5 will do the second line of defense treatment, and then maybe 5 won't, until you get to maybe one of the 5 that, by the time you get to the treatment that works for them, it's almost too late. And it helped me kind of understand why those types of tests are really important. And because insurance is on a state-by-state basis, we're still waiting in New Hampshire for something to happen with biomarker testing.
Wow.
And so, that's something that I hope is on the horizon with legislation. But that's what keeps me going, is anytime anyone shares their cancer story, like I love to go out there and fight for them, because, I've got my mom, I've got my dad, my father-in-law had terrible neuroendocrine cancer from exposure to Agent Orange, but all of this just keeps me, going and fighting for, amplifying their stories.
Yeah, and as we encourage people to get engaged in the community, I hear the phrase, do what fills your cup often.
Yeah.
And if you're doing volunteer work that fills your cup, it's like energizing almost, even as it gets busy.
Yeah, exactly. And I know sometimes it feels a little depressing, like how do all these stories not, but it doesn't, because I think it's important to kind of know what you're talking about, I guess, too.
Yeah, absolutely.
Yeah.
And
Yeah.
to hear the wide and diverse experiences of people,
Yeah.
to really be able to advocate for them, right?
Yeah.
So I know that there are already volunteers in these roles, but you are part of an organization that runs on volunteer work. I know at one point I was volunteering with the ACS, just confirming contact information, I think, for testing centers or something like this, for people who got diagnosed, and resources afterwards. So I can remember days on a phone. Well, how can others get involved with this kind of volunteer work?
Yeah, so we have a grassroots manager. Her name's Grace Filer, and she's specifically for New Hampshire and Vermont and Maine. And I think we have her contact information, but everything you can read about ACS-CAN at fightcancer.org. And we, encourage lots of volunteers. Every year we have Cancer Action Day at the State House in Concord, New Hampshire. And we have our legislative priorities. That includes things like budgeting for smoking cessation and cancer education. Anti-smoking or anti-tobacco education. Mm-hmm. Last year that was cut completely from the New Hampshire budget. So we're trying to get it back into the budget for next year. And also just reaching out to legislators whenever is a legislative priority for the following year. So for instance, we know ACA tax credit enhancements were a big hot button issue. That was 2 years that we were working to get those extended before it became a
crisis.
Yeah, crisis, exactly.
Yes.
So we're always looking for volunteers who can, we call them, it's red alerts, it's who can, go ahead and send those requests to our lawmakers, so that the more requests, the more momentum you get.
Okay, that's great.
Yeah.
So this episode might be a little late for Thursday's Cancer Advocacy Day.
It's totally fine, yeah.
But so we'll be posting about it, at least on our socials, and something to mark calendars for next year, if it's every April. So we'll pay attention to when it is next year as well.
Yeah, it's every April, and because we're advocating this year for budgeting, increased budgeting, which is actually going to be for next year's budget cycle, now's a good time to also, find out everything we need to find out about making sure that we get that money in for the anti-tobacco education, smoking cessation programs, as well as the low-cost screenings for colon cancer and breast cancer and cervical cancer. So it's a good time actually to get involved now, because we're sort of building up for next year's big push.
Yeah, so we're on a 2-year budget cycle. This year we do not pass a budget.
Right.
We already passed a budget. There's also an election in November, and so I would just encourage voters to ask the hard questions to our state Senate candidates and state House representative candidates. Where do they stand on this kind of funding and these actions that can be taken? So
yeah, and I'm glad you brought that up, because if you go to fightcancer.org, it might be on there to sign up for Cancer Votes, or if you contact Grace, you can actually get the training through the Cancer Votes program so that you can ask those questions. Get those commits, and then you get all the whole kit for it and everything. So
that's fantastic.
Neat.
Yeah. And so Merrimack has 8 state house reps, a senator, and an executive counselor, and so lots of people to ask questions of. So we've shared the contact information for ACS-CAN. You've shared about how people can get involved. Do you have anything that you'd just like to leave people with today?
Yeah, I would. I would say that before I got involved with ACS-CAN, I think, things would feel futile sometimes. You talk about healthcare this, and it's no one's listening, no one's doing that. And one of the things that's been really grounding about volunteering in this capacity is that it's been the small incremental steps that have felt like you're making tiny differences. And it's been really grounding to see how, especially when things can be passed in a bipartisan way, that things work sometimes.
Yeah.
And so I would encourage people to get involved. And even if it isn't with ACS-CAN, Epilepsy has a Cancer Action Network, different organizations have that. And it's really great to be able to volunteer within that framework, get that help, have that support system, and not always feel so, kind of hopeless, I guess. It's been very grounding.
That's great. And it reminds me of that starfish metaphor, right? You can't get all the starfish back in the ocean, but the one you do get back really appreciates it.
Exactly.
Right? So little bits of progress.
Little bits of progress.
Great. Well, thank you, Maria Luisa. Merrimack, that's our show for today. We would love to hear your ideas for show topics or feedback on what you're hearing. So reach out at talkmerrimack@gmail.com. You can find us on YouTube at Talk Merrimack, or follow us on socials. We're on Facebook and Blue Sky, also at Talk Merrimack. And we'd love to hear from you. I look forward to our next conversation.